Hello, everyone, and welcome to the VBCA Podcast, where we cut through the noise, dig into the big questions shaping healthcare today, and explore how value-based care can actually deliver value, not just in theory, but in practice. I'm your host, Alex Yarijanian, and today we're pulling back the curtain on a practice that impacts millions of Americans, but rarely gets the attention it deserves. I'm talking about hidden fees and surprise bills that make healthcare feel less like a service and more like an unpredictable gamble. Imagine this. You're a patient who's done everything right. You've purchased a solid insurance plan, and that insurance plan promises flexibility, like being able to see doctors outside of your insurer's network. You get treated, you heal, and the bills start rolling in. What you thought would be a manageable expense suddenly balloons into a financial nightmare. And in today's episode, we're going to unpack how a company called MultiPlan, which many of us are familiar with in the industry, working alongside some of the biggest names in the industry, in the insurance industry, which everybody would recognize, has been accused of creating a system where patients pay more, providers earn less, and insurance, yes, MultiPlan itself, walks away with millions in profits. This is big. It's a story about fairness, transparency, and trust. It's a story we all need to hear. This particular episode is inspired by a lawsuit, a long 171-page or so lawsuit against MultiPlan, alleging a cartel-style monopoly and a chokehold over out-of-network reimbursement and that segment of the market. Let's start with the basics. For those that are unfamiliar with the terms in-network and out-of-network, here's a quick breakdown. You guys are going to need this. In-network providers are those who have contracts with the insurance company. So basically, they agree, these providers, to provide services at a discounted rate. Okay? In return, the idea is that they get a steady stream of patients sent their way, right? Referrals. You're in-network. Now, out-of-network providers, on the other hand, they operate outside of that insurance network. They don't have pre-negotiated rates with insurance companies, which means they charge what they believe reflects their true cost of service, right? That's why they didn't sign the discounted contract from the insurance company. That's why they're out of network. Now, many patients, you might have been one or had a loved one who wants to go to an out-of-network provider because of a number of reasons, including specialist access or services that aren't in that network of your insurance companies. And insurers offer plans. For example, when we hear PPO, the idea is that there's a flexibility built into it so that you could go outside of that provider insurance network and be able to still get some insurance reimbursement. But here's the catch. Out-of-network claims are often reimbursed at much lower rates. And insurers rely on companies like MultiPlan to determine just how much or how little actually they should pay the providers. So your insurance company contracts this other company called MultiPlan to handle all those out-of-network claims. And this MultiPlan gets to decide what rate they're going to pay. So this brings us to the heart of today's story. According to a recent lawsuit, as I mentioned earlier, filed by the American Medical Association and the Illinois State Medical Society, MultiPlan, alongside other major insurers like UnitedHealthcare, Cigna, and Aetna, has allegedly created a system that underpays doctors, overcharges employers, and leaves patients to fill the gaps in what they call a criminal cartel. So how does MultiPlan work? So who is MultiPlan and why are they at the center of this controversy? So MultiPlan is what's known as a third-party repricing service. So their job is to review out-of-network claims and recommend what they believe is a fair reimbursement rate. But here's the kicker. MultiPlan doesn't work for you, the patient, or even the doctors. They work for the health insurance company. So here's how it works in practice. A patient goes to an out-of-network provider and receives care. The provider then submits a bill to the insurance company that the patient has presented. Instead of paying the full amount, the insurer sends the bill to MultiPlan for processing. MultiPlan then uses a proprietary algorithm to calculate a reduced reimbursement rate. And it's far below the provider's initial charge. On the surface, this sounds like a way to keep healthcare costs down. right? But according to critics and according to this lawsuit, it's a system that's ripe for abuse. Why? Because MultiPlan charges a fee based on how much they save. And for the listening public, save in air quotes, how much they save the insurer. That means the lower they push reimbursement rates, the more they, the insurer, profits, right? It's a system that's been described as mafia-like, with MultiPlan acting as an enforcer. They're pressuring doctors to accept pennies on the dollar for their services, while patients and employers foot the rest of the bill. Let's put a human face on this issue. The New York Times, and I'm going to put the notes on this link here, the show notes. The New York Times recently profiled a behavioral therapist named Kelsey Toney, who works with children on the autism spectrum in rural Virginia. Kelsey charges rates that align about with the Medicaid rate in that market, a program not exactly known for high payouts in the first place. But when she billed Meridian Health, which is an Aetna subsidiary, she was told that her services were worth less than half of those Medicaid rates. Half of Medicaid's rates. As the only provider within an hour's drive, Kelsey faced an impossible choice. Either turn away vulnerable patients who you've had a relationship with, you've been seeing for a while likely, and who need access in rural Virginia, or lose money on every visit. What decision will you make? Ultimately, she decided she can't afford to keep seeing patients with that insurance company, leaving these families without critical care. And then there's the story of Gail Lawson, a heart surgery patient hit with over $100,000 in medical bills, over $100,000 in medical bills because her insurance, guided by MultiPlan, reimbursed only a fraction of her surgeon's costs or charges. These stories aren't just exceptions. I mean, we can go on and on. They're symptoms of a system that prioritizes profit over people. And for every one story you hear, there's probably 90 to 110 stories you don't hear on a conservative side. To really understand the scale of this issue, let's look at the numbers. According to MultiPlan's own claims, they processed $106 billion in out-of-network reimbursement in 2019 alone. That's out of an estimated $130 billion total market for these type of reimbursements. So in other words, MultiPlan is touching over 80% of all out-of-network claims in the United States. But the problem isn't just the volume, it's the financial incentives. For example, in one case highlighted by the New York Times, Cigna earned nearly $4.5 million in fees for processing claims from 8 addiction centers in California. Those centers, they just received $2.5 million. Meanwhile, MultiPlan pocketed an additional $1.2 million. Think about that. The combined fees for the insurer and MultiPlan exceeded what the actual healthcare provider earned for treating patients. So what's the broader takeaway here? First, this system flies in the face of value-based care, which is supposed to align incentives around improving patient outcomes and reducing costs. Instead, we're seeing a model where insurers and third-party companies profit by suppressing payments to providers and shifting costs onto patients. Second, this is a transparency issue. Patients deserve to know how their bills are calculated, why their claims are being reduced, and where their money is going. I mean, ultimately, the patient ends up with a balanced bill, right? Finally, there's a role here for policymakers, employers, and industry leaders to push for change. I mean, we're signing these contracts. Whether it's new regulations or antitrust investigations, which this lawsuit brings forth, or renegotiated contracts at your organizational level, there is a growing demand for accountability. It's supposed to be a system that works for everyone, patients, providers, and health insurance companies alike. But stories like Kelsey Toney's and Gail Lawson's remind us that there's still a lot of work to do. And I thank you for joining me on this journey today. If you find this episode eye-opening, I encourage you to share it with your network. Let's get the conversation going. I will put up additional material on the MultiPlan lawsuit because I think it's so interesting and well-written, but I'm going to do it in bite-sized chunks. You can find the links to the New York Times investigation and other resources in the show notes. And as always, I'd love to hear your thoughts. Reach out to me on social media or any way you like. Until next time, I am Alex Yarijanian, reminding you that real value in healthcare comes from putting people first. Stay informed, stay engaged, and let's keep building a system together.